Center for Ability Rehabilitation and Empowerment CARE, in collaboration with Voice, Persons with Disability Community of Practice, organized a 2 day national co-creation stakeholders convening in Abuja, Nigeria. The aim is to look at the disability laws in Nigeria and seek areas of amendment and publicity among the community. Founder CARE, Dr. Chike Okowu, and the Voice Project Coordinator in Nigeria, Akom Anya, in their separate remarks said, though the Disability Act is in place, the implementation is an issue, and it is hoped that at the end of the 2 days national co-creation meeting, more persons with disability will be included in the decision-making process. They also say at least 1% of the nation's budget should be allocated to issues of persons with disability.
We're saying that for 30 million people, an estimated number, not my figure, but that of the UN figures, we're now saying instead of 15% of the national budget, can we do 1% of our country's budget? These are documents that have been proposed at the African Union, at the ECOWAS level, and even at the United Nations level. And what this means in the struggle for persons with disabilities is that if you give us 1% of your country's budget, you will have more resources to be able to do the work for PWDs. And what we're saying again is that if you do this, the National Commission, for example, the Office of the SSAs, if we do this at national level and at state level, there will be enough, it's not going to be enough, but there will be a significant amount of resources available to do the work. And that takes me a step further. How about from that budget that we will have, private firms can be given grants to include persons with disabilities in their workforce. And by extension, with these grants, they make available spaces called inclusion for those workers and enjoy even tax benefits. Because this way, it is going to be a win-win. And the former UN Secretary General Ban Ki-moon says in during his time in the UN document of 2010 that knowing that 15% of your country's population are persons with disabilities, not including them in your plans and in your workforce means you are losing 15% of your gross domestic product. There are many PWDs who are very resourceful. If you bring them into this equation, you'll be gaining 15% more in your GDP.
The Disability Act has been in place for a while now, and yeah, we've had some very good initiatives. More people are becoming more aware of issues around disability and all of that. People are becoming more aware of the need for inclusion. However, implementation is still a problem nationally. So we're looking out for how more persons with disability can be included in the decision-making process of Nigeria, in the economic situation of Nigeria, where they're empowered to sustain themselves. These are people that need to be integrated into the society and included in what we are doing, like politics, economic empowerment, political positions, party leadership. It is very important that everyone is brought to the table, because once we do not include everyone, we are depleting the workforce of the nation. And of course, we don't want anybody to be left behind.
Other stakeholders at the event expressed their opinion on ways of inclusion of persons with disability.
When you look at our Disability Act, which was signed in 2018, and there are lots of lacunas there that needs to be addressed. Number one, accessibility. The accessibility issue is something that needs to be seriously addressed. But today, we go to public buildings, they are not accessible. Go to schools, they are not accessible. During electionary campaigns and all that, during elections, people with disabilities find it difficult to be able to navigate and exercise their franchise. So these are the things that we need to be addressed.
We acknowledge that more needs to be done. The National Disability Act post-moratorium presents an opportunity to intensify our efforts Our renewed hope agenda priorities. You know, this regime, one of our agenda is renewed hope.
When the Disability Act was passed into law, it gave a 5-year moratorium grace period for all public buildings to become accessible and for certain conditions to be put in place to enhance the access and inclusion of persons with disability. And that period elapsed in January this year. So we're saying now that it has elapsed, what next? How do we begin to hold governments accountable? How do we begin to hold institutions accountable? Every public building in this country is supposed to have, during that period, modified its physical structure to allow persons with disability to access those buildings. So imagine having a primary health center in a local government in a state in Nigeria, and a person on wheelchair cannot have access to the health facility because the building has still not been altered. These are the issues that we want to bring forward, and to say that it is high time for the Disability Act to be taken seriously, for it to be implemented, and for the sanctions that are contained in the act to actually begin to take effect. So
The theme for the 2 days convening is the National Disability Act Post-Monitorium, Advancing Inclusion and Accessibility for Those Vulnerable and Outside the Margin. Emmanuel Onu, News 24.